before the storm. No, we are going to have a nice evening here with everybody. And so 6 o'clock, 7 o'clock, whatever. I want to commend our nonpartisan staff for responding to things I didn't know what they were responding to, but it's a lot of details. And it's these are laws, so I think it's probably good to, get most of the words in the right order and insert the right word "not" here and there or something. So anyway, so Ms. Strand, tell me do you know what we're doing first? Do we have a stack to go through, or is there a
Senator
sheet?
Abler, are you able to turn on your camera?
Oh,
Mr. Chair, I think nonpartisan has a list of all the sections we're going to adopt, so I think it would be best to start with them.
good. There you go. I wanted to hide.
Ah,
So
thank
this
you.
is the new sheet here? Okay. Sweet. All right, there's another sheet. Did everybody, 106 people on YouTube. We are,
Senator Abler?
it's amazing, and we do have snacks here tonight, courtesy of, anyway, what's her name again, John? Yeah. Yeah, so it's good to have, I'm not sure if that's allowed in the Senate, but don't tell anybody, at least we're not broadcasting it on the House brought it over. No, they didn't, actually. Anyway, so we're going to go through the same kind of list, and then there's a bunch of other amendments to go through, I think. And so, Representative Liebling, are you ready to do the script? So, House 1, Article 1, Senate Article 13, Department of Health Finance.
Yes, Mr. Chair, and I think as we go through this, let me just say that, first of all, as you said, I mean, the nonpartisan staff are just tremendous, and the partisan staff too, I have to say, and everybody's been working really hard all afternoon, and we have reached a lot of agreements. And I'm really glad that we're going to be able to adopt a lot of the language items tonight. I do want to just suggest, because the list was, we wanted to get back here, and there's a lot of material here, a lot of work's been done. So, I know I personally haven't had much opportunity to sort of check the list, and we know our nonpartisan staff are so good that I feel always confident in them. But I just want to say we might want to go through a bit more slowly just to make sure that we're vetting it and everybody's making sure that it is what we all intended, just to make sure, as you said, that we don't make at least avoidable mistakes. There are always going to be mistakes in a bill like this, but at least we try to avoid them by making sure we all know what we're doing. So thank you for that.
So they can explain it, and then you'll move it. And so
Absolutely.
actually, with that idea, perhaps, we do have a pretty large audience here as well. So if there's something you think, like it was just the most terrible idea, just jump up and down and scream if you're in the audience, would you please? All right, so who's Ms. Kavanaugh? Thanks.
Mr. Chair and members, starting with House Article 1, Senate Article 13. The first is to move Senate Article 13, Sections 15 and 23. These transfer the administration of the fetal alcohol spectrum disorders prevention grants to MDH.
Yep, Mr. Chair. And I would just say that as I'm going to move this one, but I just want to note that there was a small fiscal note on this for administration of the grants at MDH, and MDH has agreed to absorb that cost, which is why it's able to be a non-cost item. But I do want to just make sure that people know that there was indeed a cost, and there is a cost on this for administration of the grant. So with that, I would move adoption of Senate Article 13, Sections 15 and 23.
All in favor?
Aye.
Almost nobody voted for that one. Opposed? It's adopted, fortunately.
The next sections is Senate Article 13, Sections 5 and 17 through 20, with the A31 amendment. And these deal with the exempting from the DHS background studies individuals who are licensed by a health-related licensing board. And went through a criminal background check as part of their licensing process.
Is it the 131 amendment?
Yeah, I think Ms.
The
Kavanaugh
the
misspoke.
A131 amendment.
Yeah.
And
on
Mr.
We have
the
it.
Chair,
131 amendment, we're going to take out lines 1 through 23 to 1.32. Just strike that from the amendment because later on, that language is already in the House, Article 19, Section 26, and when we get to that article, we'll just adopt that section at that time.
Representative Liebling, if you want to move the oral amendment, then incorporate that, and then we'll vote on the amendment as it's been amended.
okay, I guess I'm unclear about an oral amendment. We need to move the amendment first, I think, which is, so I
Right,
will
move the amendment.
move the SCS 4410A 131 amendment. And was there an oral amendment to
Ms.
that
Kavanaugh
amendment?
can state the oral amendment.
Yeah, Mr. Chair and Representative Liebling, just delete from the amendment 1.23 to 1.32. This is going to be done in another part of the bill.
And
Okay, and
you
so
can
I
just
would
incorporate that if you want.
Incorporate that amendment, sure.
Okay. All in favor of the amendment as amended, say aye. Aye.
Aye.
Opposed? It's adopted.
And then, Mr. Chair, I would move Senate Article 13, Sections 5 and Sections 17 through 20 as amended.
Mr. Chair.
Representative Albright.
Thank you, Mr. Chair. Representative Liebling, I'm looking at, and I apologize if you've spoken with the agency about this, but on line 1.17, is that the fee that you're speaking of that has been waived by the agency?
Representative Liebling.
Well,
Mr.
Mr. Chair, I don't have the book in front of
Actually,
me, so someone would, and we're
Senator
we're on a
Benson knows the
different one
answer.
now. Yeah.
Let me just call on Senator Benson.
Yep, Mr. Chair and Representative Albright, this is part of a streamlining process. So someone who's licensed by the medical board has a fingerprint background check, doesn't also have to have a fingerprint background check at DHS, but they still need to do the wraparound maltreatment investigation. And so there'll be a slight increase in the licensing fee at the medical boards to cover the cost of doing that wraparound check. But this way, a licensed medical professional doesn't have to have duplicate fingerprint background checks.
Representative Albright.
Thank you. So Senator Benson, are we diminishing the standards for which a person is required from a transparency basis in order to deal with people?
Senator Benson.
Thank you, Mr. Chair. Representative Albright, right now, for example, a nurse who is licensed by the Board of Nursing undergoes a fingerprint background check just to get her license. If she then wants to work in a hospital licensed by MDH, she has to have a Department of Human Services identical fingerprint background check. And then if she wants to work in a nursing home, she has to have yet another digital fingerprint background check. What the Department of Human Services does is something called a maltreatment. It's a wraparound, so it checks periodically to make sure there have been no maltreatment allegations. So now instead of that nurse having to get 3 fingerprint background checks, she will get 1 fingerprint background check, but the roster of all the licensed medical professionals will be sent to DHS, checked for maltreatment investigations, and those maltreatment flags will be sent back to the medical boards to do the investigating. So it doesn't lower any standards. It just means our licensed medical professionals only go through the process one time. And Mr. Chair, if I could, Representative Albright, you're aware that we have a backlog of more than 300,000 fingerprint background checks that need to be put into place for individuals before they can work in a licensed facility. This will take a significant number of those out without lowering standards or putting anyone at risk.
Representative Albright.
Thank you, Mr. Chair. Thank you, Chair Senator Benson.
Yeah, this is actually
And
a
if-
great improvement. Representative Liebling.
Yeah, thank you. And I think actually, Representative Albright, I think your question, which was triggered by my comment, the comment I made about the fee that is, or the costs that we're not carrying was actually about the previous provision. And that is an item that is transferring the administration of the fetal alcohol spectrum disorder grants from MDH to, from DHS to MDH. So the advocates for those, for that program would rather have the program housed at the Department of Health. And so that's the one that I was saying that the Department of Health has a small cost for their administration of those grants, but we're not carrying it. They're absorbing that cost.
Representative Albright.
Chair Liebling, thank you for that clarification.
Yeah, thanks for the question.
A motion, please.
Yes, so, all right. So I'm going to move then adoption of Senate Article 13, Sections 5 and 17 to 20 as amended.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted. Celebrate that one. Okay, House Article 2, Senate Article 13, Department of Health Policy.
Mr. Chair and members, the first section for consideration is House Article 2, Section 7. This specifies that fees for copies of medical records are not to be charged for patients who are receiving public assistance or are represented by a legal services program or volunteer attorney to appeal a benefits denial of certain federal programs.
Mr. Chair, I would move adoption of House Article 2, Section 7.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
The next section is Senate Article 13, Section 7, Clause 31, plus the amendment SCS 4410A119. The underlying section is an exception for the hospital construction moratorium for critical access hospitals that have an attached nursing home
That's it.
and fewer than 25 beds. And the amendment makes the exception apply to hospitals in Cook County and Monoman County.
And I have a question about that.
Representative
Ms.
Liebling.
Clark-Fist. Thank you, Mr. Chair. Ms. Clark-Fist, it's supposed to apply to 2 hospitals. And is that what this does? Because I assume there's only one in each of those counties.
Ms.
That's
Clark-Wist.
correct.
Oh, thank you.
Mr. Chair and Representative Liebling, that's correct.
All right, thank you very much. So if we're ready then, Mr. Chair, I would move adoption of Senate Article, let's see, am I on the right thing? Senate Article 13, Section 7, Clause 31. Oh, I'm sorry, we have to do the amendment first. So I would
Right,
move
the
the
119.
amendment. Yeah, I would move the SCS 4410A119 amendment.
All in favor, say aye.
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 Opposed? Senator Uckey, did you want to? Oh, okay. All right, so Representative Liebling.
Okay. All right, and now I would move adoption of Senate Article 13, Section 7, Clause 31 as amended.
All in favor, say aye.
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 Opposed? It's adopted.
The next section is House Article 2, Section 12. This clarifies the definition of electronic monitoring for residents of certain long-term care settings.
I would move adoption of House Article 2, Section 12.
All in favor, say aye.
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 Opposed? It's adopted.
The next series of sections are House Article 2, Sections 29 through 67 and 81. These modify provisions governing the licensure of assisted living facilities, including provisions governing applications and licenses, compliance with design requirements, required notices, contact information, controlling individual restrictions, information that must be included in an assisted living contract, and changes to the Assisted Living Bill of Rights.
Mr. Chair, I would move adoption of House Article 2, Sections 29 through 67 and 81.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
The next section in this article is Senate Article 13, Section 21, and this relates to the Health Department recommendation for foreign medical graduates to obtain a J-1 visa waiver.
Mr. Chair, I move adoption of Senate Article 13, Section 21.
All in favor, say aye.
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 Opposed? That's adopted. Skipping the next article that has nothing. House Article 4, Senate Article 3, Healthcare Policy.
Mr. Chair, the motion here would be to move House Article 4, Sections 1 to 6 and 8 to 11, and also the S4410A58 amendment. This is the DHS healthcare policy bill, so there are provisions dealing with the managed care ombudsman, foster care, clinical trials, and trusts and annuities. The amendment is DHS technical assistance that clarifies the reference to kinship assistance.
All right. Mr. Chair, I would move the S4410A58 amendment.
All in favor, say aye.
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 Opposed? It's adopted.
And then I would move adoption of House Article 4, Sections 1 through 6 and 8 through 11 as amended.
All in favor, say aye.
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 Opposed? It's adopted. House Article 5, Senate Article 14, Health-Related Licensing Boards.
Mr. Chair, the motion here is to move House Article 5, Sections 1 through 6. These sections deal with practice supervision requirements for licensed professional counselors, marriage and family therapists, and social workers.
Mr. Chair, I would move House Article 5, Sections 1 through 6.
All in favor, say aye.
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 Opposed? It's adopted.
The next section is House Article 5, Section 19. This is the podiatrist licensing residency requirement date change.
Mr. Chair, I move adoption of House Article 5, Section 19.
All in favor, say aye. Aye.
Aye.
Opposed? Thank you.
And the last section is Senate Article 14, Section 29. This permits a nurse who desires to practice in a nursing facility or assisted living facility whose license has lapsed to apply for re-registration.
Mr. Chair, I move adoption of Senate Article 14, Section 29.
All in favor, say aye.
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 Opposed? It's adopted. House Article 6, Prescription Drugs.
Mr. Chair, the motion here would be to move the S4410A66-2 amendment. The amendment modifies procedures related to prescribing controlled substances for intractable pain and also for treating intractable pain. So the amendment replaces House Section 56 and Senate Article 14, Section 27. The amendment includes technical assistance from the department. It also includes the Senate language on the inclusion of APRNs and physician assistants and on not providing exemptions from civil and criminal action.
So, Mr. Chair, I move the S4410A66-2 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
And then, let's see. Mr. Chun, I might need your help here. What is the underlying?
Mr. Representative Liebling, I think that motion would be sufficient. So the amendment would be in the bill. It replaces some sections in that article.
Oh, so, all right, that's done then.
Oh, so do we, oh,
So we adopted the
Okay.
amendment, so we're good. Okay, House Article 8, Senate
Okay.
Article 8, Community Supports and Behavioral Health Policy.
Mr. Chair, members, the first motion is the one leftover section from this afternoon having to do with the DHS Community Supports and Behavioral Health Policy Bill. This relates to the telehealth provisions. It's with the S4410A44 amendment. The amendment reconciles the telehealth provisions that were originally in House Article 8 with the provisions that were in House Article 3.
Mr. Chair, I move the S4410A44 amendment.
All in favor, say aye.
Aye.
Opposed?
And then, Mr. Chair, I move the for adoption, House Article 8, Section 25 as amended.
All in favor, say aye. Aye.
Aye.
Opposed? Thanks for your participation. It's adopted.
Mr. Chair and members, the next motion is to adopt Senate Article 8, Sections 10 to 12 with actually two separate amendments. The SCS 4410A102, which is technical assistance from DHS related to increasing the capacity of ICFDDs in a single-family home from 6 to 8 beds. And then the second amendment is SCS 4410A123. This is also technical assistance from DHS to remove the original Senate position of allowing the licensing of a 6th bed in a group home, and instead to restrict the Senate position to allowing of variances for a 6th bed in group homes.
Representative Liebling?
All right. So, Mr. Chair, I would move first the SCS 4410A102 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
Then I would move the SCS 4410A123 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
And then, Mr. Chair, I would move adoption of Senate Article 8, Sections 10 through 12 as amended by those two amendments.
Very nice, and thank you. All in favor, say aye. Aye.
Aye.
Opposed? That's adopted.
Mr. Chair and members, the next motion is to adopt Senate Article 8, Sections 17 and 18 with the S4410A94 amendment. These two sections have to do with allowing guest speakers to present information to clients in substance use disorder treatment programs. And the amendment tightens up the qualifications and standards for a guest speaker.
Good.
All right. Mr. Chair, I would move the S4410A94 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? And I want to thank the House for working with us and DHS for some technical advice to help guest speakers be a part of the SUD programming. I think it actually will make a very good difference, so thank you very much.
No
Representative
clowns,
Liebling.
I take it.
What's that?
No clowns, Mr. Chair.
Oh, no
Never
clowns.
mind.
No, no clowns, yeah. This does not allow for clowns, so.
It's the no clowns amendment that we
That's
just
funny, yeah.
adopted.
Thank you,
Okay.
Representative Liebling.
All right, so Mr. Chair, then I would move the Senate Article 8, Section 17 and 18 as amended.
All in favor, say aye. Aye. Opposed?
Aye.
It's adopted.
Mr. Chair and members, the next section is Senate Article 8, Section 44 with the SCS 4410A122 amendment. The amendment deletes the original Senate proposal related to performance assessments of contracted case managers and substitutes in its place language requiring counties to inform individuals receiving contracted case management who they may contact at the county in the event that they have a complaint about their contracted case management services.
All right,
Thank
Mr.
you.
Chair, I would move the SCS 4410A122 amendment.
All in favor, say aye. Aye.
Aye.
Opposed?
And then-
It's adopted, sorry.
Okay, and then I move adoption of Senate Article 8, Section 44 as amended.
All in favor, say aye.
Aye.
Opposed? That's adopted. And this is, it turns out that when you contract with case managers by the counties, no one really knows who to talk to about it. So this will help. Just a very small step. Thank you. Representative, or actually,
Mr. Chair, members, the last provision in this article for tonight is Senate Article 8, Section 59. This is a provision extending the SUD paperwork reduction implementation timeline.
Mr. Chair, I would move adoption of Senate Article 8, Section 59.
all in favor, say aye.
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 Opposed? It's adopted. House Article 9, Senate Article 1, Community Supports.
Mr. Chair, Danielle Pinelli from House Research. The only section in this article for consideration is House Article 9, Section 2, which modifies the home and community-based services service termination requirements.
All right, thank you, Ms. Pinelli. So, Mr. Chair, I would move adoption of House Article 9, Section 2.
And thank you. I just want to comment. It's just really too bad we need to even be talking about this. But I want to thank a lot of people who worked on this section. Mr. Parker, Disability Law Center, and a whole group of people. I just want to, this is an important piece of work. So thank you. All in favor, say aye.
Aye.
Opposed? It's adopted. And thank you. House Article 10, Senate Article 4, Behavioral Health.
Mr. Chair and members, the first item in behavioral health is to move Senate Article 4, Sections 1, 5, 61, and 62. These are the sections requiring mental health data to be provided to law enforcement when a person is involved in a mental health crisis, and the law enforcement agency responds to the crisis. The provisions also add community corrections and local law enforcement to multidisciplinary adult protection teams, and there's a provision requiring written mental health data policies.
Mr. Chair, I move Senate Article 4, Sections 1, 5, 61, and 62.
Thank you. I just want to comment about this. Actually, connecting the mental health data to law enforcement could just turn some of these cases around in such a good way. So, you know, they're words on paper, but some of these are really going to make a difference. So, I know a bunch of people worked on this too. So, Representative.
Thank you. Thank you so much. And since we're paused on that for a moment, maybe I could just ask Ms. Sunderman to just, because this is one that, as it was going through, there was considerable discussion and, you know, concern about this in the committees in the House. And so I just would want to ask Ms. Sunderman, just the data that's being shared, is this the one that's, they're basically sharing the name of a provider who works with the client? Is that what's being shared?
Let me double check quickly. Yes, the disclosure may include the name and telephone number of the provider providing treatment, and so they can discuss strategies for assisting the person in crisis.
Thank you. Thank
That's
you.
awesome.
Very good. Very good. So it's been moved, Mr. Chair.
Oh, yeah. So all in favor, say aye.
Aye.
Opposed? Little happy dance on that one. So, okay, go ahead, staff.
Mr. Chair and members, the next item is House Article 10, Section 15. This is a clarification from the department on tribal federal block grant RFP requirements.
Mr. Chair, I would move for adoption, House Article 10, Section 15.
All in favor, say aye.
Aye.
Opposed? It's adopted. Thank you.
Next item is to move House Article 10, Section 63. This is a Certified Community Behavioral Health Clinic, CCBHC, federal conformity provisions.
Mr. Chair, I would move adoption of House Article 10, Section 63.
All in favor, say aye.
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 Opposed? Adopted.
Next item is House Article 10, Section 66. This section provides increased flexibility for psychiatric residential treatment providers with overnight staffing ratios.
Mr. Chair, I move adoption of House Article 10, Section 66.
We are doing some good work. All in favor, say aye.
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 Opposed? It's adopted.
The next item is House Article 10, Sections 76 through 78. These sections are federal conformity sections for IRMS, intensive non-residential rehabilitative mental health services. It lowers the age limit pursuant to the state plan.
So, Mr. Chair, I would move for adoption House Article 10, Sections 76 through 78.
Yeah, and just so people know, we're undoing something we tried to do last year, I think, trying to raise the age to 26 for some of these folks. And the Fed said no, so we had to go back to the old way. All in favor, say aye.
Aye.
Opposed? It's adopted.
Next item is to move House Article 10, Section 88. There is an amendment for this. It is SCS 4410A125. And the amendment just reinstates the language requiring the commissioner to approve the eligibility for the Transition to Community Initiative.
Mr. Chair, we have the amendment we need to adopt on this one. I'm sorry, Ms. Sunderman, did you say what the
125.
amendment?
Yes, it's the SCS 4410A125.
Okay, so Mr. Chair, I move the SCS 4410A125 amendment.
All in favor, say aye.
Aye.
Opposed? It's adopted.
And then I would move adoption of House Article 10, Section 88 as amended.
All in favor, say aye. Aye.
Aye.
Opposed? Adopted.
Next, we have House Article 10, Section 95. This is just a revisor instruction to update medication-assisted treatment terminology. This was requested by the department.
Mr. Chair, I move adoption of House Article 10, Section 95.
All in favor, say aye.
Aye.
Opposed? It's adopted.
The last item in the behavioral health article is to move the S 4410A45 amendment. This would add a section making extensive changes to Children's Therapeutic Services and Supports, CTSS. There are lots of updates and clarifications. It modifies definitions, clarifies services to be provided, certification procedures, clinical infrastructure requirements are modified, service delivery criteria, provider requirements, and documentation requirements. And it also repeals a section related to these changes, or subdivision related to these changes.
Mr. Chair, I move the S 4410A45 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted. Oh, that's all. We were just moving the amendment. Okay, so that's the section there. And we run a very complex system here, I'll tell you. So read some of that if you're just a passerby, like, I have no idea what they're talking about. House Article 13, Senate Article 10, Child and Vulnerable Adult Protection Policy.
Mr. Chair, members, there's one item in this article for tonight. It's to move Senate Article 10, Section 53. This is extending the effective date for last year's mandated reporter expansion.
Yes, Representative Pinto.
I think, Mr. Chair, I think there may have been a misunderstanding on this one. So I think this was to be moved with, there was an amendment for the next section, Section 54, which also relates to the same topic of the Legislative Task Force on Child Protection. And so I think I'd sent that out to staff. I don't know if we are ready to adopt that or what the situation is, but I think we were moving those two things, we were traveling together.
Yeah, this one, can we hold off on this one, Senator Abler? This one's not ready.
Sure.
Thanks.
House Article 17, yeah, so we sort that out. You know, maybe we can get it done, if you know what you want to do, maybe we can even get it done yet tonight if you can sort it out, or if it's complicated, I don't know. I don't know what the next plan for coming back to work on this again is. I haven't talked to Representative Liebling, but anyway, House Article 17, Senate Articles 12 and 16.
Mr. Chair, members, we need to reconsider the motion from earlier today to adopt Senate Article 16, Section 15. It should have been to move to adopt Senate Article 16, Section 35. It's just an error.
Okay. So, Mr. Chair, so I move to reconsider the motion from earlier today to adopt Senate Article 16, Section 15.
All in favor of reconsidering that motion, say aye.
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 Opposed? It's reconsidered.
All right, and then instead, I would move to adopt Senate Article 16, Section 35.
All in favor, say aye.
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 Opposed? It's reconsidered and fixed. Also, Article 18, Senate, and I just, have you read, I mean, just look at the detail that we have to have staff go through with the pages and all that. There is so much behind the scenes. I just wanted to commend everybody that's sorting all this stuff through, from making the copies and bringing snacks. Senator Hoffman. Senator Hoffman.
Thank you, Mr. Chair. I have a question. Back on House Article 9, sorry if I'm going backwards. I think, was Section 4, was Section 2 taken out by mistake, or was Section 2 not, I mean, what was the agreement there? Because I thought there was a Section 2 and a Section 4 that needed to be agreed on. Is it just Section 4?
House Article 9, Senate 1.
Yeah.
Talking about Article 9, Section 2.
Yeah, Section 2 does not make sure that people who live in their own home settings have the same appeal rights as people in residential settings. So, no, Section 2 is adopted, but is there any way we can include Section 4 that would be there, that would be also in there, because Section 2 alone doesn't make sure people who live have the same appeal rights as, and I think our intention was to get the appeal rights.
Was that part of the package?
I had thought so. I think our Disability Law Center, I don't know, Maren Halden, if she's on, are you?
I don't imagine.
Or not? I mean, is this not a time to have a conversation, but?
Representative Schultz, are you keeping track of this on your side?
Or yeah, maybe you can just bring it up tomorrow.
Well, let's just see where we can get a little bit now. We're just trying to move through here. Representative Schultz, are you familiar with this situation?
I will have to go back and review it. Let's ask DHS this question, please.
Yeah, we can either do it now or offline, but let's give it one shot there. Who's from DHS? Ms. Grom? Whoa. I haven't heard much from you lately. How about that? Welcome. Look at this. We're doing work. We got amendments. And you wrote half of them, so.
Thank you. Thank you, Mr. Chair. Christy Graham with the Department of Human Services. We are fine with adding Section 4. That does correlate with Section 2. You're correct, Senator Hoffman.
Okay.
Senator Hoffman.
Thank you, Mr. Chair. It sounds like I was correct.
Senator Hoffman, would you want to move House Article 9, Section 4?
Always laughing.
So, Mr. Chair, I'm a little bit lost here. Are we?
Well, we went back in time.
It was my bad. I just caught something.
We're way back on the second page, and Senator Hoffman noticed the section that was left out.
Yeah.
And it actually wasn't inadvertently left out as part of a project. And Ms. Grom just said that that's actually totally consistent with what they're trying to do with this information about closing places. And the House had the superior language because they worked on it more there. So this is a House section.
Yes.
Yeah.
Yeah.
So he's suggesting that we adopt House Article 9, Section 4, which will complement Section 2.
Thank you.
And I just thought he could make the motion since it was his idea.
Yeah, I'm just a little, what we're doing here, and just, as you know, and just for the public, is kind of, going down the script of things that were previously worked out. And I'm just a little, when we then start adding things on the fly, I don't know how many of us are actually looking at the language and so on. I know I'm not. I'm just kind of, you know, as we do, because as you noted, it's so complicated, we
Oh, sure.
rely on our nonpartisan staff and so on. So I don't know, I guess I would just ask Chair Schultz, because this is her area.
Yeah, just so you know, we're suggesting to adopt a house section.
Yeah, yeah.
I don't know if
Yes,
you're
I'm-
comfortable with it.
Chair
I don't know if
Liebling,
you
this
can
is-
vote for that thing,
I
Representative Liebling.
approve of this
Okay.
adoption. It's fine.
Okay. So, all in favor of deferring to the House in this section, say aye. Aye.
Aye.
Opposed? Thank you. Thanks, Senator Hoffman, that's funny. Anyway, so let's move on to House, back to the script, Representative Liebling. Anyway, almost the last page is blank, which is even more frightening. House Article 18, Senate Article 10, preventing homelessness.
Mr. Chair, Danielle Pinelli from House Research again. There's just one item in this article to adopt. It's Senate Article 10, Sections 9 and 11, which adds a homeless youth provider repair or improvement grant program. And that's with the SCS 4410 A124 amendment. The amendment just increases the maximum allowable grant amount from $100,000 to $200,000.
Thank you. Yeah, Representative Liebling.
Yeah, Mr. Chair, I would move the SCS 4410A124 amendment.
All in favor, say aye.
Aye.
Opposed? And I don't know who from DHS knows this. I know there was some, I'll use the word confusion about the RFP. What an effective date? You can think about that a year ahead or from now or something. Make life simpler. So I don't need that question right now, but I think it's something I was thinking about. So let me know. Let's move on. Oh, did we? Let's adopt that
We've got
now.
to adopt it, Mr. Chair. I think you might like it to be adopted.
Let's do that, yeah. So,
Yes. Yeah, so I would move adoption of Senate Article 10, Sections 9 and 11, as amended.
all in favor, say aye.
Aye.
Opposed? So we'll talk about that
Mr.
effective
Chair?
date. What's that?
It's Dennis.
Oh, hi, Dennis.
On the issue that you just brought up, is not an effective date issue. It is a rider issue. So
Okay.
we can work that out either
Yeah.
later today or tomorrow, but it's not the effective date.
Very good, just as peaceably as it can be. All right, so that's adopted. All right, we're done with that. Thank you, everybody. House Article 19, Senate Article 11, DHS licensing and operations policy.
Chair and members, the first item is to move House Article 19, Sections 7, 10 to 23, 28, and 29. Section 7 modifies licensing requirements for SUD treatment providers that serve clients with their children. And the remaining sections are from the DHS licensing and operations policy bill, and they modify withdrawal management program, staff qualifications and personnel policy requirements, and then other provisions related to SUD treatment program licensing. And there's also a repealer related to that.
Mr. Chair, I would move House Article 19, Sections 7, 10 through 23, 28, and 29.
All in favor, say aye.
Aye.
Opposed?
Next item is to move House Article 19, Section 26. This is the extension of the waiver for DHS background study requirements until January 1st, 2023.
Mr. Chair, I move adoption of House Article 19, Section 26.
All in favor, say aye.
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 It's adopted. I think that's good news for some people. Okay.
And then the last thing in this article for tonight is to move the S 4410A91 amendment. This is related to the above item, but it adds further DHS temporary waiver extensions for related to fingerprint-based background studies.
So, Mr. Chair, I move the S 4410A91 amendment.
All in favor, say aye.
Aye.
Opposed? This also is good news for some people, I think. Representative Liebling.
So now we're on
Oh, that's
to
all.
House
Oh, that's all.
Article
Sorry,
22.
read my script here. House Article 22, Senate Article 3, House Miscellaneous, Senate Healthcare. That's a funny way to put them together.
Mr. Chair and members, the sections in this article to consider are House Article 22, Sections 1, 3 through 9, and 11, plus the S 4410 A92 amendment. The sections establish requirements for products that contain cannabinoids that are derived from hemp, and the amendment inserts language exempting cannabinoids derived from hemp from Schedule 1 of the Controlled Substances Schedule, and delete amendments to Schedule 1 relating to the House initiative to reschedule cannabis.
So, Mr. Chair, first I would move the S 4410 A92 amendment.
All in favor, say aye. Aye.
Aye.
Opposed? It's adopted.
And then I would move House Article 22, Sections 1, 3 through 9, and 11 as amended.
All in favor, say aye. Aye.
Aye.
Opposed? That doesn't legalize marijuana. We just didn't do that, did we? Okay.
Oh, are you kidding? Of course you have. No,
It's all in the fine
just
print.
kidding.
Okay.
Just kidding. Next, we'll do that next, okay?
So who's going to lead us through the next? There's still a pile, and there's, yeah, Ms. Bailey or staff or people just have amendments on their own. Is that what you have? Well, actually, so let's just go through who's got the is the A74 anything? The best interest of the child. Oh, this is Senator Anderson's amendment. Isn't this the development of disability one? Yeah, the A74. This has to, can anybody describe the A74 for us? Leah Monahan's name is on top. So. Sorry. You have
Mr.
it?
Chair, it's my understanding that this was discussed among the conferees.
Okay.
And
Okay. No, so I'll just move it. I'll move the A74. Any discussion?
Yeah, Mr. Chair, could we talk about what it is? I'm not sure I have that in front of me, actually.
Was this discussed in the HSR cluster? Maybe.
Mr. Chair, this was an amendment that was added to the DHS policy bill clone when it was heard in civil law. It adds developmental disabilities to, I actually don't have it in front of me. Thank you. To the items that the court needs to consider when making a custody or parenting time decision.
Right. And Representative Schultz, I think, did we all talk about this? I think it's a really good amendment. And this was.
I don't think we discussed this, Senator Abler.
Okay. Are you familiar with this topic?
Did JP send this amendment to us?
We can put it aside if you want to think about it. So what it does, it just includes development of disability along with people with special
Okay,
medical and
let's
mental health.
let's hear from DHS on this right now, if
Oh, sure.
possible.
Hello, DHS.
Good evening, Mr.
Summersfeld,
Chair.
there you are. Hey, we
Hi
did
there.
get you out.
I guess,
Got you out into the meeting. That's good. Good to see you again.
good to see you. I guess I'm the default tonight. This actually doesn't have an impact on DHS. This is amending a family law statute. I think it's 518.17, if I remember correctly, from when I've seen it before in my past experience in family law. So we have no concerns.
Representative Schultz. Is everybody
Well,
okay?
can we just see I don't see the language. Can someone send it to my email?
Yeah,
Yeah,
I
it
don't,
was in the
Mr.
staff,
Chair, I don't
so.
think any of us have seen it.
Really? It's in my pile. Is it, yeah, I don't know how, I mean, this Zoom thing is God bless technology, but it'd be fun to have you sitting right here. do our side conversations in secret.
If Mr. Yates could send out the pile that you have next to you, that would be helpful electronically.
Yeah, sure. Well, let's come back to this one. I think it's worth doing, and I think it's fine, but let's, so I have a stack here with us, and we don't have a lot of, yeah. Have we, did somebody have the A79 amendment? Representative Pinto. So we're just going to go through these amendments, and people are going to talk about, I've got a sequential pile here, and at the end, we'll see what's left to talk about.
So, Mr. Chair, this gets us back to the provision that we had skipped earlier, which is from Article 10, Section 53, which extends, which would extend the date for the mandated reporter issue for youth recreation workers. In connection with that, the Senate had a Section 54, which modifies the duties of the Legislative Task Force on Child Protection. Pardon me?
Okay.
Oh.
Oh, keep going.
Well, yeah, I was just going to, okay. And so we had discussed adoption of Section 54 of Senate Article 10, but doing so with the A79 amendment. So I guess I would, if the chair is okay with this, I would move the A79 amendment to Senate Article 10, Section 54.
And this gets it in the shape that you and Senator Johnson had agreed.
That is correct, Mr. Chair. This is the shape that Senator Johnson and I were the two co-chairs of the task force. Yep.
I remember we talked about it.
Yeah, thank
Any
you,
questions?
Mr. Chair.
All in favor, say aye.
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 It's adopted.
Thank you.
The A85 amendment.
Mr. Chair, though,
Oh.
should we adopt then the underlying, the Senate sections?
Oh, I don't know. What's that, what should I, was that amendment suitable? Do we need any more amendments? Actually, this came from the House.
I think, Mr. Chair, well, I'll let
Is
you
it a
finish.
stand, Mr. Monahan?
Mr. Chair, Sarah should probably speak to the amendment, but I believe
Chair.
this provision was explicitly discussed among the conferees.
And we agreed to this?
Mr. Chair, I think so the Senate, Article 10, Section 53 is, of course, on the list, and then Section 54 is the companion provision. We had this amendment from Senator Johnson and me, and then the idea was then that Section 54 would be adopted. This is from the Senate bill as amended, and so the two sections then travel together. I don't mean to be.
It's not like the most big issue ever in life. It's a pretty small item, but, so how do I find that?
So Senate,
Line 312.
yep. Article 10, Sections 53 and 54.
Oh, what article is Senate Article 10 in?
Senate Article 10.
Mr. Chair, House Article 13.
Oh, pardon me. I see.
I remember we talked about this, it seemed like it was So it's on page R46, A13. Oh, there it says that. Okay. Anyway, so Representative Pinto, can you explain to me what's going to be there left when we're done with your amendment?
Yes, Mr. Chair. What I'm about to move is adoption of Senate Article 10, Sections 53 and 54 as amended. So the A79 amendment that we just passed does amend Section 54. And so then we would be adopting Senate.
When we amended Section 54, what did we change?
So what we changed was you'll note that the Senate current Section 54 greatly simplifies the duties of the task force because it's essentially out of date, and so we're catching that back up. And so what this does is has the task force not focus specifically on the mandated reporting requirements for the youth recreation programs. That's the real issue. is
So,
to say,
Representative Pinto, when we made our first, this is the second amendment to this section.
not amendment, Mr. Chair.
This amendment is not, this section has not been changed.
This section has been amended by the A79, and so at this point, we would then be adopting the Senate section as amended.
Oh,
So not attempting to amend any further, Mr. Chair.
I understand, but
This is, this was that we were okay and Pinto was going to work with the Senate on language. And I think this is the approved, agreed upon language.
Agreement.
yeah, just, Mr. Monahan looks skeptical, so I'm just trying to, is it all right?
Would you like to have a recess so we could discuss this?
This one?
Yeah.
Let's put this, can we
Yeah.
just, let's just put this aside for the moment. So the Senate language is amended for the moment. Let's just let it sit there.
And
we'll,
Mr.
there's
Chair?
a few things to, I don't think it's that complicated, but,
Yeah, Mr. Chair.
yes.
You know, I think it might be more efficient here if, I don't know if Mr. Yates already sent out all of the amendments in one group, but maybe we should take a little bit of a break so that we can all have those in front of us. And
You
then,
don't have a pile of amendments in front of you?
no, I don't. I'm trying to pick them out of my email. And, a lot of other things come through the email besides the amendments.
Oh,
And
sure.
so I'm trying to find them and print them. And if I have a little bit of time, and especially if they come to me all in one email, I can print them all out and have a pile just like you do. But I don't have that right now. And I don't know how many members do that are at home. Representative Gomez just put in the chat that she's in the same situation. So I think it really would be helpful if we could, if Mr. Yates has them all and can put them all in one place.
Mr.
and
Yates,
send
do you
them
have
out.
them in one bulk email? Or are they in small doses?
Mr. Chair, I can certainly send everything that has been sent to me. I have also posted them. If you go to the Senate calendar and look up our hearing, you can see everything that I've received has been posted. I can also take that same file and email everything out to people.
Yeah. Representative Liebing, can you go to the Senate announcement page and read it off of that? That would,
I think, Mr. Yates, if you could send a link to that page via email, I
Yeah.
think that should be sufficient.
right, and so let's just take a couple minute breather and get that squared away, and I'm gonna, so how's that?
That sounds great. So you
So
want
we're
to
just
pick a
in a short
time? Or?
recess.
Okay.
Rejoin the call, that's all, Senator Abler.
$140 and plus, several hundred in the room, it's close to 1,000. It's amazing. Maybe. Get it going here. Better than Muzak.
As people may
That's
know, it's not your regular committee process because anything we adopt here is likely going to become law. So,
It's like a regular conference committee process. Anyway.
well, yeah.
So very
well,
good. So
sort
let's
of.
just,
Right.
what? It might become law? That's
Well,
funny.
I want people who are
I got it,
watching to
I got it.
understand that this isn't, this is there's a lot at stake when we agree to one of these amendments, which some of us may not have actually seen. And I did go to your webpage and I have it up in front of me here on another computer. And it's a very long list and some of these amendments have already been adopted. So, I still
right.
don't have a stack of amendments. So I just want you to know that we're going to be very reluctant to accept
Okay.
anything that we haven't fully
I got it.
vetted.
So if a member doesn't have an amendment or they want to wait, we'll just
Yeah.
let them sing out. So let's just go in order of my pile here. The A85, this looks like something that Mr. Albrecht might have come up with. Yeah, we're gonna redraft that amendment. It actually needs a little
Mr.
work.
Chair,
Mr. Monahan.
can I direct you to remove from your stack the A85,
Yes.
the A98, and the A132?
I would be happy to accept your direction.
Those three amendments are related to a different conversation you intend to have later.
Sorry, keep them though?
Keep them,
Okay.
but they are unrelated to the policy discussion we're currently having.
Oh, I do understand. Very nice. Okay.
So,
Don't
Senator-
throw them away. We're just going to put them aside. So we're just in order. We're going to
Okay, so Senator, maybe this would be helpful. You have a pile in front of you that you intend to go through. Maybe you could give us the list in order of the
Oh, sure.
numbers, and then staff can try to make sure that we
That's a
have
good idea.
the amendments.
Okay, so there's a A93. How slow should I go?
No,
Write
you
'em.
can just give us a list. I'm
You
just
want to write
writing
them
them
down?
down,
Okay, so
and
the
staff can write them down.
93, 99, 109, 117, 118, 121, 126, which I'm not sure we're doing 126 tonight, but anyway, so that's the pile. So now we'll go back to the A93. And who's would like to have the honor of offering this? Is that Representative Liebling? This is, I know this topic very well. This is codifying the governor's executive order.
Senator Abler, not all of those are listed on the committee webpage.
Yeah, that one isn't.
Okay, which one is not?
The A93.
Okay, I think I got that in my email.
Yeah,
Look
that's,
for it.
is this posted, the A93? Well, you have most of them. So the A93 is, you can do it. Senator,
Maybe does Patrick McQuillan have the A93? I had a copy. That's how you got it printed off. Does Patrick have it?
Mr. McQuillan, do you have that? It came from you guys.
Yes, Senator. Let me try to find it in my email.
All right, if you can get it out to your members, that would be good.
Mr. Chair, it is now posted.
Thank you very much. So I understand this to be the codification of the governor's executive order of the sub-cabinet to, so did, who wanted to offer this? Did someone from the House want to offer this?
Well, you know what, Mr. Chair, I think I might want to offer it, but I think I'd like to pass it for now because I think I need to. I just received the language myself.
Oh, okay, that's fine.
And would just like to confirm with the agency that this is what they want and et
Yeah,
cetera.
sure.
So,
All right, very good. Let's put that aside. So let's move to the A99.
I'll offer the A99.
Okay. And can you tell us what it is?
This is the amendment that increases the number of members on the subminimum wage 14C task force.
Oh.
Well, we've done that, but it allows us to, if we don't adopt this amendment, the Secretary of State has to make those appointments, and that there's a long delay in that process. This amendment allows the members to be appointed by the Legislative Coordinating Commission, so it can happen much sooner, which is, I think, what we all want.
Members don't have the 99?
That one is posted,
No,
Senator
it's in our
Abler.
file.
Oh.
Or is that the subminimum? Yeah, Representative Senator Utke.
Okay, thank you, Mr. Chair. And I think as I was looking for my amendment, I heard this was for the sub-minimum wage. Is that correct?
Representative Schultz.
It allows the Legislative Coordinating Commission to appoint additional members to that task force, correct?
Okay, thank you. Mr. Chair, I would like to wait on this because we're going to have that discussion when we get to the spreadsheet because it's got costs, so it's going to fall under that category. And we could talk about the whole thing at that point, if we could.
And so I know the cost is very low on this particular amendment, but I know on the Senate side, there's some deciding about who's on there with much more specificity.
That is correct.
And so, anyway, Representative Schultz, are you familiar with that position of the Senate?
No, could we adopt this onto our side, on the House side?
Yes, you could.
Okay.
So let's do that. I think that'd be, it's very appropriate that the House could have its own position. So if staff could give directions about where on the House side this could be adopted, or is that already part of the amendment? It's probably not part of the amendment, but I think that's a very good idea.
Mr. Chair?
Senator Benson.
If Representative Schultz could help me, I have not seen, and maybe it happens and I just haven't seen it, Legislative Coordinating Commission appointing someone, and I understand these are individuals with disabilities representing different populations. So we're deleting the Commissioner of Human Services. Representative Schultz could help me understand why we're using the Legislative Coordinating Commission, because I don't know that they have particular expertise in this area.
And so maybe briefly in this, what we're doing now is putting into the House side, and so I think it'll be discussed at a later time to a little more detail. But certainly, Representative Schultz, if you want to comment, and then I'm personally comfortable with letting the House have whatever they want on their side. So, but it's a good question. Thank you. Representative Schultz, do you know the answer?
I think currently our language is that it's the Secretary of State that makes the appointments. And so this would replace that option with the Legislative Coordinating Commission.
All right.
Mr. Chair?
Senator.
And Representative Schultz, it appears that we're deleting the Commissioner of Human Services and inserting the Legislative Coordinating Commission.
Right.
And so I don't see where it deletes the Secretary of State.
Let's bring in DHS for consult here.
Okay, well.
And Mr. Chair, I'm fine if we want to adopt the language and continue to work. I just want to make sure that we have an appropriate body doing appointments.
Right, and so I think that what we're going to do now, if I could just, it's already getting late, and we have a bunch of things to talk about. So, Mr. Monahan, if you can give us advice, or Ms. Kavanagh, or somebody from the House could tell us the proper motion to make to put this into the House language and let it rest quietly there for now.
It's drafted to the House.
Oh, it is?
Language.
Okay, well then, very good. Oh, then we would just, so we're going to amend the House language but not adopt the section. Okay. So all in favor of that amendment, say aye.
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 Opposed? Okay, the House language is now adopted. Thank you, Mr. Monahan, for that clarification. Okay, now we're on the A109. Anybody want
Thank
to
you,
claim that one?
Mr. Chair. I'll move the A109.
Okay, discussion to the A109. Ms. Senator Benson, you want to describe it?
Mr. Chair, this is a Senator Rosen bill. It passed off the Senate floor. I believe the vote was 67-0, but I know it was a unanimous provision. What it does is extend licensing for nurses, respiratory therapists, and other medical professionals. If they are fully licensed in another state and they apply to be licensed in the state of Minnesota, it lets them practice here for 90 days while the appropriate board is processing their Minnesota license. And this is not to be confused with a compact. This, in fact, undermines the need for some of our compacts because it does allow somebody to come here and work for a time as their license is being processed. They are people who intend to continue to practice in this state and are going to go through a full licensing process, having been licensed in another state. And Mr. Chair, nurses already have this provision for 60 days. As we have gone through COVID and have seen the need for flexibility and a shortage of some of these medical professionals, this provision was something that we used throughout the pandemic, and it helped our care systems have the flexibility and some of the resources that they needed in moments of crisis. And, you know, we could see this being used during a flu surge, which we oftentimes get in February, or if there's a COVID variant that emerges in November, this could be an important provision. And so I'm happy to answer questions as best I can. This was very bipartisanly supported in the Senate.
And as I recall, even Senators Eaton and Murphy voted for it. There was no votes. Discussion.
Mr. Chair.
Representative Liebling.
Well, first of all, I want to have a roll call on this because I don't believe our side is going to support it. And we just had a policy negotiation, and I categorically rejected this. I believe if that's what this is, and I must tell you, I still haven't found the actual amendment. I do not have the amendment. All I have is Senator Benson's description. And I believe this is the policy provision that I said that I was opposed to when we had that discussion. First of all, we did not hear this in the House. This makes a pretty big change. And one of the things that it does, and I don't know, maybe before I go on, I should find out if Senator Benson, if I'm indeed on the right provision. This is the one that has the Board of Medical Practice giving temporary licenses to people who apply, even if they haven't completed their application. Is that the one we're talking about?
Senator Benson.
Thank you, Mr. Chair and Representative Liebling. They have to submit the full application. They don't get to short. If some of the paperwork takes a few days to get processed, it's just like we do for nurses, except the nurses get 60 days currently.
Well, Senator, today when we were negotiating this remotely, I read the provision very, very carefully, and that is not what it does. That is not what it does. It actually removes the requirement that right now they can get temporary permits under current law, but they have to have completed their application. And this takes that away. It takes away the requirement that they have to complete their application. So, I mean, I'm just flat out opposed to it, Senator, and we're just not going to accept it. So if you want to go to a vote, we can do that, or if you want to withdraw it, but it's going to get, I believe that it will get a negative vote here in the conference.
Any more discussion? You ready for a roll? Seeing none, the clerk will take the roll.
Mr. Chair, I was,
Just a minute, stop the roll.
okay, and Mr.
Senator
Chair, I know
Benson.
that you called.
That's fine, I'm happy to
I know that
start
you
the roll.
called for a vote, but the boards have reviewed this and they stand behind it. And it says an applicant for licensure under this section may request the board issue a temporary permit upon receipt of the application, request for a temporary permit, non-refundable application. You have to be licensed in good standing, not be subject to discipline. A temporary permit is issued, and during that time, they do all of the work for licensure. And as I said, we are doing this for nurses right now, 60 days. We're expanding this to other licensed medical professionals. We did this for respiratory therapists during the pandemic, and it was a huge help to our systems. And I know, Representative Liebling, you said you didn't hear this. I understand that, I respect that, but the Senate has taken a number of provisions that we did not hear because we did the work, we saw what was necessary, and we worked with the department to make sure we were comfortable. And I know that we sent the language over. We gave you notice that we wanted to talk about this tonight, and so I am happy to have this roll called.
Well, Mr. Chair, I'm
Liebling.
just saying, Senator, that I disagree with you. We didn't hear it, but I'm telling you, I disagree with you on this provision. That's really what it comes down to. And I'm really surprised to hear you say, oh, well, the boards are good with it, so okay. You know, I've never understood you to trust government just because it's government that says something, and that's kind of what I hear you saying here. Oh, the board's good with it. That's only the beginning of the question, not the end. So
Mr. Chair.
I've just asked members to vote no.
Sure. Senator
Mr.
Benson.
Chair and Representative Liebling, the board is responsible for professional standards. Stakeholders brought this forward. Senator Rosen took it through the entire public hearing process, and it passed off the Senate floor. So when I say the boards are good with it, they're responsible for upholding the professional standards. They don't bless every legislative idea, but it has gone through the process, and the boards have participated in this to make sure their professional standards in the state of Minnesota will be upheld. That is their responsibility. Ours is to listen to stakeholders and bring forward ideas. That's what Senator Rosen did, and the Senate supported it in a bipartisan way.
So I'm sorry I jumped the gun on the vote. Any further discussion? I don't see any hands online, so now the clerk will take the roll.
Senator Benson.
Aye.
Senator Abler.
Aye.
Senator Curran.
Aye.
Senator Hoffman.
Aye.
Senator Utke.
Aye.
Representative Pinto.
No.
Representative Albright.
Aye.
Representative Schultz.
No.
Representative Liebling.
No.
Representative Gomez.
No.
All right, well, there being 5 ayes on the Senate side and 1 aye and 4 nays on the House side, the amendment is not adopted. Okay, thank you. The next one is Amendment A117. I can move that one. This is the long-term care consultations recodification, which has passed the House and is waiting on the Senate floor. Any questions about this? Seeing none, all.
Senator?
Yeah,
Senator?
Representative Liebling.
This is the recodification. Maybe we could just have staff confirm that this is the same bill, and I'm not finding it on the postage.
Chair Liebling and Senator Abler,
Yes,
is this the long-term care recodification technical bill?
it's the, Mr. Monahan, I'll let you describe it. It's the recodification of min choices and all that.
Mr. Chair, members,
Mr. Monahan.
yes, the language in the A117 is identical to the House file, the second engrossment that was sent to the Senate. So not the substituted Senate language, but the original House language, with one change at the end of what is now or will become Article 23. Page 21 of the amendment, there's a reviser's instruction. We added paragraph C, and we made some changes to paragraph B to include a direction that any amendments made during a special session of the 2022 legislature would also be handled by the reviser editorially.
Yeah, it's actually regular or special session, so it doesn't mean we have to have a special session. That's not, this
No, it
doesn't
does
require
not.
that? Oh, thank goodness.
I was just, if we pass this to the Senate, why are we bringing it into conference committee? Could the Senate just take up our bill?
Actually, we might need that bill for something later. So that might be how we get out of here. So we wanted to be sure it got done, and my suggestion is we put it here.
So, Senator, I wonder if the House staff that worked on this is available. I don't know. Representative Schultz, was that Ms. Prunelli, or who was it? Do you know?
I think it was Ms. Punelli. I don't know if they're all on here tonight though with us. So, it's the same language. I'm comfortable with the language. If everyone's comfortable with the process of bringing this entire bill. I don't know if that would be a burden on staff or not, but.
I'm very uncomfortable with it, in part because this is a many-page amendment, am I right? And I do not see it posted, and
Well, we can
it is
hold
not
on it.
posted.
Representative Liebling, it's House language with a couple tweaks.
Well, you know what, Senator Abler, that may very well be, but I think because we're adopting it into a conference report, it would just be really good for us to,
Representative Liebling, it's now
confirm.
posted. So let's just hold on this for a little bit, and you can read it over and have your staff look at it. But I can just tell you, if
Chair?
Mr. Monahan said it's what it is, I will assure you it's what it is.
Mr. Chair,
Representative Gomez, hi.
yeah, I'm just wondering if you guys are planning on offering other amendments that aren't listed on that page, can you please instruct your staff to go ahead and upload them? Because I personally, I don't sit on either of these committees in the House. I haven't had a chance to read this language, and I'm kind of like, if anybody's following along in the public, your huge viewing public that we've heard about, I mean, I don't know how they would be able to track this because it's hard for me to track it. So I mean, honestly, like from my perspective, I thought that we had spent all day kind of like negotiating about these things. And so I had an idea about what we were going to come in here and adopt, and I was able to read through them and ask questions about things I didn't understand. And right now it's kind of like, I mean, it's 10:30. I don't know where a lot of these documents are. So just if there's some way that it can be a little bit more kind of easier to follow along, that would be great for me. Because again, as I said, I don't sit on these committees in the House. So I'm kind of
Didn't
Well,
catch it.
it's the custom of each body to help the members of their own side to get what they might need. I do know on the Senate website, there's a posting for the conference committee, and at least most, if not all, these amendments are going to be posted there. So we're not trying to do anything clever. We're just trying to.
Well, Mr. Chair, they're not. That's the exact point. I have it open next to me right here. And I keep looking for the amendments that you're mentioning, and I do not see it. So
You're asking the wrong guy. I don't know how to post anything. So is the A117 up there now? It's up there now.
Mr. Chair, it is uploaded, and just to get ahead of the next one, if anyone on partisan staff or nonpartisan staff has the A121 amendment and could send it to me, I'd be happy to post it.
Mr. Chair?
Where are we? Representative Gomez?
Yeah, hey, I mean, I'm just, I understand you're saying like it's each side staff's responsibility to get us the materials that we need, but I mean, if I have somebody who's on my phone right now who is following along, who's from the public, and they don't have staff providing them with materials. And I mean, it seems like it's pretty basic that if we're on the conference committee page, people should be able to reference the materials that we're talking about here.
I couldn't agree with you more. So for whatever technical thing, I apologize as far as I have the power to. I'm happy to put something aside. We're not trying to rush anything. For just my sake, I thought this was a pretty easy one since we're accepting the House language, and it's a recodification and all that. So,
Mr. Chair.
Senate Representative Liebling.
So just to that point, if this is so easy, we've all day been engaged in trying to negotiate what was going to be agreed upon and adopted. This could have been brought up and probably would have just been adopted. I don't understand. I feel like it's a bit of an ambush here, honestly. And I'm very uncomfortable with this process.
Well,
both for transparency and also because I think, as Representative Gomez said so well, it's incumbent upon us as members to understand what we're doing here. So,
totally agreed.
yeah. So you had
I think
mentioned,
I don't think we could remember everything we want to talk about. It's certainly, this is not a clever move, I will assure you. So let's just put that aside, and let's take up the 118. Do people all have that? And this has to do with numbers and words. 2,000 medical assistance patients. This is that.
Mr. Chair.
Senator Benson.
Mr. Chair, I'll move the A118.
Okay.
This is so the Department of Human Services can establish a project that will evaluate a new category of FDA-approved medical intervention. So this would be a third category. It's a digital intervention that helps with substance use disorder. It was recently FDA approved. Several states have incorporated this into medical assistance coverage, and several health plans actually are starting to include this because it has been determined to be both safe and effective. And so this would be a pilot project, but it is contingent on receiving a third round of federal substance abuse mental health services grants, the SOAR grants that are issued by the federal government. And if that money is not received, then these projects wouldn't go forward. So it's a contingent request from the legislature that this work be given priority. And if someone from the department is on, I'd appreciate comments for the benefit of the committee.
So who would that be?
I do have a comment on this, Senator Abler.
Representative Schultz.
I think that we would have a concern using the SOAR money for this item. I think this would have to be general fund so we could talk about it on the spreadsheet.
Mr. Chair.
Representative Liebling.
Mr. Chair, so I think this one was just posted. I haven't seen the language yet, but I do know a little bit about this, and I'm going to oppose this amendment, just to ask members to vote no. I'm going to ask for a roll call so that we know how many votes we get on each side, and I don't think we need to spend a lot of time on it.
Okay, Mr. Chair,
Senator
I'm
Benson.
going to withdraw the A118 amendment, and instead of having a negative position, I'd like the opportunity to reach out and see if there's a way we can get this done.
Very good. The amendment's withdrawn. Now, we did the 821, that's a guest speaker one. We don't need to do that one again, right? Okay, and I think we're going to hold on the 126.
And Mr. Chair, we could go back to the A93, which I think was that codification of the executive order, if I'm not mistaken.
yeah. So, Representative Liebling, did you want to move that?
So I will offer the A93.
All right.
And let me pull it up here, because I have confirmed that this is indeed the language that was requested. So this just codifies an executive order from the governor on improving the, let's see, there was a desire to move forward with making some improvements around substance use disorder. And so this was something that the governor had put in place, and you can see that this isn't exactly something I'm all that familiar with, but one of my colleagues has told me that this has been worked out, that he spoke with you, Senator Abler, and you may know more about it than I do, actually.
Actually, I know quite a little. I think this is a very important amendment, and I appreciate it. Actually takes the governor's executive order and takes another step toward more effectiveness. And it would be my intention with the adoption of this that I would withdraw my effort to create a new department of behavioral health. And the reason we did that was because of Jake here. And so many people, and the growth in the opioid deaths and tragic and all that. It's a growth industry and the wrong industry. And everything we do isn't working. And so even though the governor didn't consult with me about this order, I saw a positive direction there, and then working with some people, we were able to take the order and shooting from just, it was all about accessibility. If only one more treatment. And so we said, how about if it's effectiveness we're looking at? And so I want to thank all those who were behind the scenes working with me on that. I did wordsmith some of the language. And the department and the governor are in line with this, I'm told. And so what's going to happen is there's going to be a sub-cabinet of a number of commissioners and a director hired. And at this point, cost is all borne by DHS. And the director is going to work with a sub-cabinet and an advisory council who will talk to them about ways that can make a difference, both about disproportionate, committees affected disproportionately, as well as just to be more effective. It's and so then further, there's the governor. This is from the executive order originally, that they're going to review the department in a way that we were hoping they would anyway, and bring a report back by December. And in addition to that, they will bring back a plan to see if we really want to create an office of this, which would be this director and one person. So, Senator Utke.
Thank you, Mr. Chair. And on this, looking at bottom of page 3, it appears there's going to be a cost. So is this going to need to be moved over onto the spreadsheet and have a proper fiscal cost applied to it?
Actually, no, the department's going to absorb the cost.
Okay, they're covering the compensation and the whole
Right,
works.
the executive order, see, the executive order created all this, and every person, it's the sub-cabinet already paying these commissioners. The people coming to the meeting, and here's 15 of them. The governor's executive order made DHS pay for that. DHS is going to pay for the review and whatever planning. And so that's, the cost is covered. So that's what I understand at least, and I was told.
Okay, we're looking at the bottom here, and it's 15.059, and it talks about the compensation for councils and committees. That's what we're wondering about, is to make
Right.
sure we've got, that's in,
That's what.
fully understood.
And if, we can, DHS can confirm that if you would like. But Senator Benson?
Yep, thank you, Mr. Chair, and I just want to make sure that as we pass something, we don't end up with asterisks on a spreadsheet somewhere. So if
Yeah.
DHS can comment that they are in fact absorbing this.
Who's here from DHS?
Hey, this is Commissioner.
Harpstead. Well, there you
Yeah.
go.
Yeah, we are indeed absorbing the costs of this, yes.
Nice to see you for that little.
Senator Abler, I have a
short cameo.
question. How much is the cost that DHS is willing to absorb?
I think I'm going to
What's
ask
the total
Commissioner
cost?
Harpstead that question.
I don't have that off the top of my head. We'd have to go look it up.
Maybe we should wait until we have that cost.
Yeah, maybe we should wait until we have that cost. You know what? We passed it the first time. Maybe we have other things to do that we could,
Well, we didn't vote on this yet, so we could.
no, I know.
But I do think it's
So-
something very important to do, and we can take time and look at it.
I
hope we can do it.
Senator Abler, I have another thought. If it costs, if it's a cost item, really should have a fiscal note and it should be on the spreadsheet. That's just my personal view of these items, even if
Representative
DHS
Schultz,
says they're going to absorb it.
the commissioner just said there is not going to be a cost. So
Mr.
I
Chair,
think I would trust.
we can amend this to say within existing appropriations,
I think that would be a friendly amendment.
or whatever Dennis
Just would
recommends.
keep them at their word.
Mr. Albrecht
All right.
recommends.
All right. You know what,
Mr.
Mr. Chair, I'm going to withdraw the amendment just right now because I think we can handle this later. And especially if we're going to start amending on the fly, and I think maybe we do need to have some more discussion before we move this.
Very good, but this is, I'll just show my hand. This is something I don't want to lose in the process, personally. I think it's.
Understood,
we have,
Mr.
and
Chair.
Representative Liebling, and I'm friendly, I like your amendment, so.
No, Mr. Chair, I think we probably are going to be fine. And I think, in your discussion, I appreciate your discussion of it. I just, again, here we are, it's 10:45. I offered an amendment that I haven't even fully read myself because I just
fine.
got it. And
Actually, I
so
like your amendment.
we'll just put a pin in it for a little bit and come back
Okay.
to it maybe tomorrow or something like that.
All right, so Representative Liebling, what is your, tomorrow, we have, did you want to come back tomorrow at 1 and work on some more of this sort of stuff? If we're going to come back tomorrow and do some of this then we don't need to go very late tonight. Because we've done the easy stuff for tonight. We've talked about going through some of the hashtag topics, which we could just do tomorrow if you're going to come back at 1.
Well, Mr. Chair, I mean, okay. Well,
What's your, I'm just asking what your pleasure is. We
indeed.
can burn through till midnight if you want. That's as long as we can go.
How many more amendments do we have, Senator Abler?
A handful.
Okay, that was
I
my
think,
question
I
as well.
think that we need to get if we really are serious about getting a policy bill, and if we are serious about getting a Health and Human Services appropriation spending bill, then I think we need to get our work done. And I don't think we can wait till 1 o'clock tomorrow because we need to give staff time to put this policy bill together. And we need to give staff and the revisor time to put together a spending bill.
I'm not arguing.
And I think the Senate needs time to give us another offer on a spreadsheet offer to make movement on the spending bill. So
Fair enough.
maybe we should stay here and wrap up all these policy bills as much as possible. And then anything else that's left over, we can put it into the fiscal spending bill.
So I'd like to ask you, Senator, what your intention is tonight. If we can get through all of the amendments on the policy, was it your intention to close this bill, call it a policy bill, and sign the report? Or were you
No, I
planning
think
to
we
keep it
have
open
tomorrow.
and put the fiscal on it as well? Is that, what was your intention?
I think if we got a number at noon tomorrow, we could probably get something done by tomorrow night, maybe to put in here, but I don't know that we can get that, that's going to come at noon tomorrow. And to logistics, I'm not sure if there's an official answer. I will tell you my personal answer, that I think this should be, whatever happens to this bill should be done by tomorrow night. I've been talking to staff, and that seems like it's a reasonable schedule. I don't think going into Saturday on it makes a lot of sense, if I'm right about that. If we do as much as we can now, at least it helps make it better. But I think we have tomorrow to do some things to this bill, whatever residue policy or such, and then we could put the finance on a different vehicle, perhaps, the mid-choices, is what I was holding in reserve. I don't know. You know, you and I, we're for how our great power, Representative Liebling, we are mid-level managers here. So trying to work this department as best we can, and I think we're doing pretty good. So let's go a little longer then. And
All right.
But for instance, items like the recodification, I didn't want to lose that, in the fray, that's all. And so.
All right, well, Senator, if we're not going to actually close the bill tonight, I would suggest that some of these that we kind of know what they are, the recodification, the one that we just talked about, we know what those are. If we want to adopt them tomorrow, we can do that very quickly and continue on with our work. The only real advantage, and I'm fine with finishing up whatever else you've got tonight, but the only real advantage to finishing tonight is if we were going to close the bill so that we could, close a bill so that the staff could start processing the bill. If we're not going to do that, get as much done as we can, and then we'll have these couple of large pieces, which we may or may not include, but we now need to understand what they are.
And so the only thing I was
So I
hoping
think
to
we've got a
close
path.
tonight, formally would be the discussion. But there's some things to
Okay.
discuss, and so that's
All right.
not close it in a way that you'd have to stop. But anyway, there's three. And just on the policy, we met with DHS today on the vulnerable adults section, and staff is not ready to have their little language. But so I can tell you what we agreed to if staff wants to prepare something for tomorrow for the vulnerable adults article, which is in Article 13. And frankly, I wouldn't mind adopting some sections, but you'd probably be more comfortable. That's sections 30, House Article 13, sections 30 down to, I think, 38.
It goes through 42, but I believe there's a few sections that you may have concerns with.
Right. Anyway, so, and this is probably just as well done. If you wanted to, I just look on these faces here, like, don't do that to me. Anyway, so the position the Senate has in talking with Senator Matthews is to take the entire piece of legislation with the exceptions of Section 33, paragraphs C and E, which are the purview of the judiciary. So that's, I'm not moving that, I'm just announcing it to you if you want to write it up or something for tomorrow. And Mr. Monahan, do you want to write that up, or should I just make a motion to adopt that like I said? What's your comfort level?
If you feel comfortable that you can identify the proper sections, you can
We
make
could
whatever
adopt-
motion you'd like.
All right.
We can move those sections, Senator Abler, and adopt those except for the.
But then there's
okay.
one other thing, Mr. Burdick. There was one other matter that there's an amendment that the DHS is going to prepare to define that a spouse is not a caregiver. It's a really a cool section of law. It changes, so if there's an individual person who's maltreating themselves, it's not the responsibility of the person that they live with, and they're going to focus on services to that individual. And if you have a caretaker, if you have a spouse, there's a caregiver definition there, if you're hiring somebody or whatever. But if you're a spouse, it's not clear that that's not a caregiver. And so if the husband who's just not taking care of himself isn't doing that, and the spouse couldn't be convicted of that. So by clarifying that a spouse is not a caregiver in the definition of this maltreatment, that was an important piece, which I thought made sense. And then DHS can provide that to whoever they provide things to. But Representative Schultz, I agree. So I guess I would simply move.
Mr. Chair?
Mr. Monahan.
The amendment that you just referenced.
Yes.
Is prepared.
Oh, it is?
JP, I believe, has the amendment.
Well, then, okay, if that could be given to us, that's perfect. Okay, well, let's go back to that one that we put aside. Mr. Monahan, is that other amendment printed for Representative Pinto's matter?
Mr. Chair, yes, it's the SCS 4410A133.
I don't know, what number was it?
The A133.
Do you have the A133? Oh. All right. So Representative Pinto, let's go back to this.
Thank you, Mr. Chair. Oops, thank you, Mr. Chair. Senate Council discovered an error in the A79, and so I think I'd like to first move to reconsider the adoption of the A79.
All in favor of that, say aye.
Aye.
It's reconsidered.
Thank you, sir. And then in replacement, offer the A133, which has the intended effect of the A79.
Okay.
And I appreciate Senate Council catching that. I was skeptical.
We should
That was
discuss
silly.
this a little more thoroughly. Could we spend some more time on this? No. All in favor of the A133, say aye.
Aye. Aye.
Opposed? And now we have to adopt this section, correct? Two sections. Mr. Monahan, could you state the motion, please?
I believe the motion would be in House Article 13 to move Senate Sections 53 and 54 as amended by the A133.
Is it Senate Article 10, Mr. Moynihan?
Yes, this is from Senate Article 10, sorry.
Thank you.
And so moved, Mr. Chair.
So it's been moved. Everybody understand this? Any more time spent on this? No, it's a great idea. Thank you. And the League of Cities, sorry it didn't fix everything, but they care. I got that. So anyway, all in favor of that, say aye.
Aye. Aye.
Opposed? Nice to get that put aside. So what I have left, Representative Schultz, we were talking about adopting the hashtag stuff. I don't know if staff is prepared to do that tonight.
I'm so sorry. Were we going to go back to the vulnerable adult policy language?
We can.
Or do you want to adopt those,
No, I figured, did you
everything
want
but section 33 CE, but adopt everything else?
there's an amendment coming, I think, or is it
Oh.
already out? Is it copied? What number is the amendment, Mr. Monahan? And so just to the people who
The
are watching.
A128.
128. Anyway, so between people scattered around in multiple sites and staff everywhere in this post-COVID thing, I think we're doing pretty well. So. Okay. I'll move to A128. And so in terms of making sure legislative intent is clear, this is meant to make sure that a spouse or sister, brother, friend, whoever is helping this person who's not their guardian, who just forgets something or it doesn't go well, is not going to be a maltreater. It was clear in the discussion that in this I've been working on maltreatment, I think almost my whole career here, that it's about the intent. And so, but this just says basically that if your spouse forgets to do something, that's not a reason to call it maltreatment. Is that clear to everybody?
Yes.
Okay. All in favor, say aye.
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 Opposed? And then, so, let's see, I think I'm gonna move, just to make it simple here, I'm gonna move Article 13, House Sections 30, 31, and 32. And then there's a different motion for the next article, section. Everybody understand that? Staff understand that? 30, 31, 32, and Article 13. All in favor of that, say aye.
Aye.
Opposed? It's adopted. And then in section 33, I'm going to move to adopt, should I make a positive motion, Mr. Monahan?
Mm-hmm.
To move to adopt different, I'm not going to adopt paragraph C and E. Should I just say that, or do you want me to?
How about move 33 A and B?
Well, and there's also
And D.
E, F, G, goes down to J. It's quite a long section. Mr. Monahan, give me advice, please.
I think it would be preferable to do it in the affirmative, what you are adopting.
Mm-hmm.
Okay. So I'm going to move section 33. The title and paragraph A, B, D, F, G, H, and that's all that. I, J, K, L, M, N, O, P, and Q. We're just not doing C and E. Anybody want that repeated? Please, no one said they want that repeated. That was just funny. All in favor, say aye. Aye.
Aye.
Opposed? Now you know why we like the cheat sheets. And now I'm going to move sections 34, 35, 36, 37, 38, 39, 40, 41, and 42. Everybody understand that?
Yes.
All in favor, say aye.
Aye.
Opposed? And thank you much for DHS and the time today. That was really interesting, and I kind of missed talking about that stuff. So, all right, so that's taken care of. Representative Schultz, did you want to take up the 117 recodification? Is that what you were asking?
Chair Liebling, do you want to put do you want to put the recod language into this
It's not going to affect anything
policy
at this
bill?
time. It won't affect the time at this point. This is the A117.
Yeah, this is a lot of, it's a big amendment, isn't it? I think just in its, could we get advice from the nonpartisan staff about?
Mr. Monahan, would you suggest we adopt this tonight?
I won't comment on that. Are you asking, is this difficult and a difficult amendment to process? The
Yes, that's our
answer is
question.
no.
Okay, that is my question. Thank you very much for that. I mean, Chair Schultz, if this is
I'm
something
fine
you
with
wanna
that. I'm fine with that as long as it's not a burden on our staff.
It's its own little private article. All in favor of the 117, say aye.
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 Opposed? That's adopted. Representative Schultz, all I have left is a hashtag discussion. Does anybody have an amendment besides the hashtag?
I
Representative,
think,
go ahead.
I think we have additional amendments, Senator Abler.
Okay. So do you want to try to get to the hashtags, or we can maybe save
Did you adopt the SNAP language?
Did we adopt it?
Or did you agree to that language for the
Yes.
SNAP income?
We have not talked about it, you and I.
Okay,
There's a Senate position which I'm happy to adopt. Or we can talk about it. I think we should talk.
we'll table that.
Yeah, no, let's just talk about it. Yeah. Okay, sure. Senator Hoffman, did you have one you wanted to offer?
Mr. Chair, thank you. Do you guys have the A75 on file?
Do you have copies of it?
I do.
Okay. The A75.
Can I have a?
It's coming.
All right,
it-
I
it's
do not
actually-
believe that one is posted.
And some of these ones that come from members aren't always posted right off the bat, so we'll.
Mr. Chair.
We won't take a vote until everybody's got it, for sure.
Mr. Chair, if whoever from a staff standpoint has this amendment, I can post it, but I need it sent to me.
Senator, Mr. Monahan's sending it. Okay. Anyway, so while we're waiting for it to get out, Senator Hoffman, do you want to discuss it, please?
Yeah, Mr. Chair and members, there's this, this wonderful family, years ago, 3 generations, took their great-great-grandfather's farm land and they started to build nursing home, apartments, individual townhomes, and they created this organization called Mary T. Inc. And if you've ever been to beautiful Coon Rapids, which used to be part of Senate District 36, but it isn't anymore. It was supposed to be funny, Jim, but you're not laughing. The place is this wonderful structure within the city of Coon Rapids, and it really is truly, when you talk about the Latin term veritas communitas, it takes the whole community. Well, this is a veritas communitas, and that family, the Shesvold family, has been around years. They have the original nursing home, which was the Camilla Rolls, and it was really, let me give you a little bit of information. In one location, there's 50 potential beds. When we talk about the fact that we have the silver tsunami here, we have a problem with bed space throughout the state of Minnesota. We have a problem with some really good service providers in the state of Minnesota that will be willing to or able to do some innovative things in order to create opportunities for people to live. And there's 50 potential beds that will be unused as to moving from a more communal shower bath setup to individual showers will mean restructuring pipes in a concrete-based building that was built in 1970 or 60-ish, as well as cutting the room.
Have any idea?
You don't know? God, you're funny. As well as cutting.
Can we to the point, because we're approaching midnight?
No, I will get to the point. You're funny. No, but the building you know about, Michelle, is the Camille Rose building. You know it well, and so at the time of crisis and closures, there's 50 beds that are a valuable resource, and forcing this requirement on that facility that would have adequate bathing and shower space, even though is just simply not feasible for that structure. So Senator Abler, there's a simple amendment, thank you, Senator Curran, that just says, in addition to the guidelines, we're adding newly constructed assisted living facilities, and that's it to it. And so I did talk with Representative Jennifer Schultz. The professor did want to talk with you about that, Senator Abler, and this is the opportunity to do it. But that is a problem. It is a problem that is there, and we have a need for bed space for grandpas and grandmas. So,
well, thank you, and I appreciate the amendment. It's a very sound building, and the only problem is there's not a shower for all the individuals, and some of the individuals are in no position to take their own shower anyway. In fact, none of them, is that right? And so there's quality facilities just down the hall, and so this company has been admirable, and we need the beds up our way. So I hope that the House can find the merit in this amendment. Discussion.
Senator Abler, this is Representative Schultz. There are, having worked on the assisted living licensure regulations, there are a lot of facilities that could be in similar situations. So I think doing a one-off is not a good idea tonight. I think we have to take a lot longer look and make sure we're capturing all of the facilities that could potentially benefit from this. So I don't think it's a good idea for us to do this at 11 o'clock at night, because it's very complicated, and it took 2 or 3 years to get all the stakeholders together and agree to what we passed. And so when we make tweaks to it, we have to bring all those stakeholders together again.
So how about if we did it at 12 o'clock? Would that make you feel better? Senator Hoffman withdraws the amendment. I think.
Thank you, Mr. Chair. I'm glad it got out there. Thanks, Jennifer. Bye.
Mr. Chair, are we?
It's withdrawn, but if you want to say something, you sure can. Okay. There's the next, you already had one, so Senator Utke. We have a lot of fun. You actually had two. Actually, only one that counted, but anyway, Senator Utke.
Thank you, Mr. Chair. I've got the A26 amendment.
Is that passed out?
Yeah, it was part of the packet that we had on the table the whole time, so hopefully everybody's got it.
What is it? Okay.
I'm sorry, what was the number again? I'm sorry.
126.
No, we don't want to do that. Just a second.
Oh, because it's.
This is the frontline worker amendment, Chair Liebling, I believe.
This is home childcare.
Yeah, so Representative Aki moves the A126 amendment. Representative Aki. I mean, I apologize. Actually, coming from the House, it's actually an honor to be even as lowly as a representative, but anyway.
I'm not going to help dig you
Senator
out
Upke, I
either, hit that you're
apologize.
digging there, Mr. Chair, but
worse.
as this one, it's very short, the headline, frontline worker payments, with this, it's including the family child care providers, and as in the paragraph, they're eligible to receive frontline worker payments under the law that's been passed this year.
Okay, and I think this was an oversight, so any questions from this, about this?
Yeah, we do
First,
have some.
Senator Pinto. Representative Pinto.
Yes.
Okay, to the chair.
No, actually, Mr. Chair, I think this is, I know there's been some work being done on just getting the language of this exactly right. And I, really appreciate the sentiment. Probably we should let Representative Pinto speak to it because he knows more about it than I do. And I'm not sure if this is the, this looks like an updated version.
Representative Pinto.
Certain if it's right.
Yeah, Mr. Chair, definitely agree with the sentiment. It just does need some work, and I think there's going to be there'll be a cost associated with it.
How could there be a cost? It's just one more eligible worker.
Yeah, but the concern is that that at this point, the process is moving, checks are going out, et cetera. And we
No,
want
they haven't even, applications aren't even being received.
Well, I mean, yeah, I guess what I'm saying, though, is that there's the process being put in place, but I know that there's the language that needs to be worked on this as well. But we absolutely want to make sure the family child care gets support. But
Does some department know about this thing? I can't imagine why there'd be much of a cost, but.
Yeah.
Because the people, you just got to get on a list. So it's like retail.
this is up.
So there's like retail, like that's because you say I work in retail, I am a child care worker, they have to like pay they hang those little Post-it notes on the person's computer that say be sure to include the child care workers.
So I
Anyway,
do-
so Representative Pinto.
Yeah, no problem, Mr. Chair. So I do think we'll need to take a look at it, but we absolutely want to make sure that it happens. So, but I think,
All right.
yeah.
Is there,
Not at
someone
this point.
pointed out a department that can, does DHS know about this? Can they just say this is the right language at least, so when we get around to it? Somebody there?
Happy.
Still there, Commissioner? Is this the right language? Mr. Burdick, there you are.
Thank you, Mr. Chair. For the record, Matt Burdick with the Department of Human Services. I believe this is actually under the purview of the Department of Labor and Industry. I have spoken with my colleague over there, and I do think this does need some work.
I didn't hear your last bit there.
I'm sorry, this language will need some work. I am
Some work.
far from an expert on anything that has to do with labor and industry, but on behalf of my colleagues at that agency, this amendment is not ready tonight.
Okay. Senator Utke, that they say it's not, it sounds like the House wants to wait anyway, but something about it needs some work, so I don't know what that means.
Definitely
and
supportive of
Mr.
the concept, yeah, but we definitely need to make sure that the language works.
Senator
Mr.
Utke.
Chair, yeah, we're hearing the same thing because this provision did come from Senator Pratt, and I've heard that, you mentioned Department of Labor and Industry, and of course, he's our jobs chair. And
Okay.
it does sound like, yeah, just a couple little things are.
So perhaps we
possibly
could-
needed, but it's just about ready.
Yeah,
We were, I thought it was fully ready at this
Oh,
point.
yeah, that's good.
Good to go.
But I think it's the sentiment of the conference committee that this needs to be rectified. There's no doubt about
There's-
that, right?
yes,
I mean,
absolutely.
In a bipartisan, bicameral, you know, okay.
Agreed.
So do you want to withdraw it for now, then?
Thank you, Mr. Chair. I will withdraw the A126
So
amendment.
on the list of work tomorrow, perhaps Representative Liebling, we can put this in the pile for.
Absolutely, happy to do so.
And so also, there was another one we put aside, that disability thing. Let's see, that one from, yeah, here. Are you guys prepared to act on the A74, which is that development of disability, adding to the list of special medical, mental health, and educational needs?
We were still waiting on feedback from
Okay.
our Chair of Judiciary. Just give me 1 second.
Oh,
Senator
okay. You think
Abar.
you can do it tonight? I was just asking. Well, let's just, you can work on that. Senate Representative Pinto, did you have an amendment too?
There you go. My turn to get back, Mr. Chair.
Well, can this be a good one this time?
I'm thinking so. I think you're going to like it if I can find it. Here it is. Mr. Chair and members, this is about, and I mentioned this last week, the need for the Department of Human Services to be able to do pilot projects for childcare regulations. So this is Article 19, Section 27. And I mostly at this point want to highlight it. If the Senate's not at a point to accept it right now, I just really want to highlight.
What page? Just tell me
It's
again.
it's Article 19, it's the page R26. Article 19, Section 27, page R26. And I appreciate members looking at it, because I think if you look at the language, it'll make a lot of sense as to why we really do need to do it.
So R20, so this is extending the peacetime waivers until January 1st?
No, it's it's Article 19, Section 27, page R26. Should say
House 19,
Pardon me?
House Article 19.
House Article 19, I'm sorry. Thank you, Madam Chair.
Right, so I'm
It should say childcare
What
regulation, Section 27, childcare regulation modernization, pilot projects.
Mr. Chair?
That's 27. Section 20, yeah, okay.
Is it mislabeled? There may be a.
You want to
an error.
discuss what you're?
Yeah,
Does that cost any money? Or is
Mr. Chair, it is cost-free, it's policy only. And what it does is allows DHS, as they're carrying out the regulation modernization that we ordered last year, it just allows them to waive rules along the way so they can test out changes. I think we all would agree that childcare regulations are really problematic in our state, just the overall structure. And we ordered last year to have them be modernized in order to do that, to be able to test them, because otherwise you have to just do it all whole cloth and make a stab at it. This way they can test things along the way. And just allowing waivers. And so I would, if the Senate, if that might be acceptable to the Senate, I'd love to offer that adoption of that section.
Where did you get this from?
This is from the department.
Oh.
Yeah, this is the department, this is DHS policy, and they've said it's
I was hoping you'd say you thought of it, and
not this one.
then I would like it even better.
Thank you. Mr. Chair?
Yeah, Senator Benson.
And I apologize, Representative Pinto. I would like to check. Senator Kiffmeyer has been just a champion for some of these reforms, and it's my apologies. I did not check in with her today, so I'll flag it. I don't have a fundamental objection, but family child care has had a contentious relationship with the department, and I want to make sure that we're proceeding in a way that respects that tension and helps to resolve it.
I have a question, Representative Pinto. It says, in no event may a pilot, go beyond February 1st of 2024. Why do we care?
And Mr. Chair, because by that point, it should be that we have the regulations modernized that we ordered last year.
You are a man of faith. I would suggest you take that sentence out. and let the pilots stop when they make sense to have them stop. Maybe they want to, this could be something that goes on for a while. It's at the discretion of the
Yeah, and
commission.
Mr. Chair, I probably would have to have I'd love to have input from, I don't know if Mr. Burdick is on it, could just say what they might think of that.
Well, can you just take, so you're going to deal with.
But it sounds like we wouldn't be ready right now anyway, Mr. Chair,
Yeah.
so we can consider that,
So
and I
Mr.
understand.
Burdick, just if you can, I think it's stronger without that, and I'm leaning to be favorable toward it, so. Any other, so that was a thought, that wasn't a motion.
It was not, I didn't want to move it without knowing that it'd be okay with the Senate.
Well, I think it was a very
so
good thought.
Appreciate it, and thank you to Senator Benson.
Any
we'll
other
connect.
thoughts or amendments? Senator Hoffman, do you have one? You're just waving.
No, Mr. Chair, we were just talking about, I had heard when you said align waivers, I thought, oh, it's going to be more efficient. And so Senator Cran and I were just looking at
Does
what the
anybody-
process was on
Oh.
what Mr. Incoming was talking about over there, so.
So, does anybody have any other amendments? I have another topic I've been just kind of trying to break into, but, so there's these hashtags or asterisks or whatever on the offer sheets of fiscal items without a cost, or I didn't say that right. And so many of those are agreed to. It seems to me like if we have some we agree to, we should try to adopt those. Is the staff prepared to do that,
Mr. Chair,
Senator Benson?
is there a spreadsheet we're going to work off of?
That's what I'm asking. I mean, it could just as well be done tomorrow, I suppose, but because like two-thirds are agreed to, so I think it'd be suitable to get that language out of the way as well. Advice from staff?
Mr. Chair?
Just a second. Mr. Monahan?
Mr. Chair, members, Mr. Albrecht and I were able to prepare to deal with this topic.
All right.
I don't know if members have their spreadsheets or whether Mr. Albrecht can share his or whether you just want to do it all orally.
Okay. Senator
Mr.
Benson?
Chair, has the spreadsheet that we're going to work off been posted for the public?
Well, this is the offer. So it's the asterisk, the hashtags.
The hashtags.
And so then Mr. Albrecht will post that for us. Mr. Monahan, advice, so when we say we agree to, just for example, we all agree on line 151, which is children's mental health respite care clarifications. Do we have to act on a section about that, or if we say we approve that one, then you'll just get the right sections connected to it?
You will have to adopt the sections. I have at least the start of what the motion would be.
Okay.
I'll mention that one of these, I believe, has already been adopted as part of the forecast article.
Okay.
3 of them are contained entirely in amendments, and 2 would have to be motions out of the side-by-sides.
Okay. So I think we should do that, since we're trying to get all we can done per the advice of Representative Schultz that I agree with. So Mr. Monahan, would you mind walking us through that? It looks like you're leading that, is that correct? You and Mr. Albrecht, could you please post the spreadsheet on the relative section, relevant or relevant? I don't know, just put something on the screen. And then Mr. Monahan, you can start us off with your discussion, please.
Mr., you want me to share
Screen
the?
share, could you screen share the hashtag part of the last offer?
Mr. Chair, could I just get clarification? Are we just discussing these items, or what is your intention here?
It's my intention to adopt the ones that we agree on, and if you want to discuss the ones we don't agree on, which are not very many, we could do those. But I would like to adopt the agreed upon ones. If you look at the offer sheet, there are at least 6 that we have agreed upon.
Well, Mr. Chair, I here at 11:30 at night, coming to discuss policy today, I actually don't have that offer sheet here in front of me.
Well, we're going to screen share it for you.
Okay. Let's see where.
These are budget neutral proposals. That's what they
Okay.
are. And so we've agreed, it just seems like we should capture the agreements while we can, is what I was kind of thinking. But So if you're comfortable, I talked to Representative Schultz about that, and she seemed to think that was all right, so. Anyway, so Mr. Monahan, do you want to just,
Mr. Chair, can you see the,
yes, thank you.
Can you make it a little bit bigger, Mr. Monahan, or Mr.
Maybe,
Albrecht?
yeah.
Whoever's driving.
is that better?
Yes, thank you.
Then scroll it up a little bit. There you go. Very nice. Okay. So Mr. Monahan, please.
Mr. Chair, members, I'll direct your attention to House Article 10, Section 10.
These are the hashtags.
It should be on page R10-A10.
I'm sorry, go ahead. Forgive me.
Mr. Chair, should I repeat the?
Yeah, I
Correction.
think I missed the whole thing. So.
All right. I direct your attention to House Article 10, page R10-A10.
And I should just, well, that's really loud. I should just announce that, we've agreed to these, and if somebody experiences buyer's remorse, like, what was that we agreed to? Then we're making motions and we're trying to be agreeable here. So it seems like we do it tomorrow, but we're going to get to the ones we can today. So thank you, Mr. Monahan. So it's
All right.
section 10.
So the motion, well, first, what we're dealing with first is line 151 of the offer sheet, the Children's Mental Health Respite Care Clarification. And the relevant language should be on the page I indicated on the House side. Roughly halfway down the page, we're looking at Clause 3. So the motion would be to adopt House Article 10, Section 10, page 482, lines 15 to 19.
I have my language in front of me, so I understand that. Does anybody have any questions about that? Representative Liebling, do you want to make a motion? Do you want to just have that motion be yours?
I don't even, I'm sorry, Mr. Chair, I don't even really know what you're doing here. I flipped to the page. I don't know,
Okay, we're on
looking at a line on here that has hashtags. I
Okay.
can't see the top of the spreadsheet on here on the screen, but it looks to me like we're already in agreement on that item. Is that not what I'm seeing here?
Right, we're selecting the hashtags for which we have agreement, and now we're adopting them. And those are reflected by language in the side-by-sides.
Oh.
And so if you go to page,
Okay, Mr. Chair, wouldn't it be more efficient to do this by asking the staff to prepare this for us ahead of time so that we can, doing it this way on the fly and squinting at the screen at almost,
Okay.
at 11:30 at night, and I'm just really having difficulty with this. This is probably, I think your instinct here is right. We can adopt all these things. It should just go boom, 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 like we did it earlier
Representative
today.
Leamy, it is no problem at all. So if, like we said, it sounds like you're planning to call a meeting for tomorrow.
Absolutely, I am. I
And
mean,
so
we should
let's-
absolutely get as much
so-
done as we can.
So this can be on the list, as can be frontline worker and the opioid sub-cabinet and whatever things that are left. And those should move pretty
Yes.
well, I think. And then,
Yes.
and then
I think
maybe,
yes.
and if members tomorrow, is there somebody who wanted to move a section that has not been accepted by somebody and you wanted to move that to make a point or to have a discussion tonight? Anybody online? So I was just going to suggest, if you didn't do it tonight, you can't do it tomorrow. That's all I'm saying. So if you want to, Okay, so tomorrow we're doing agreements, or we think we have agreement. And so is that a ground rule we can do for tomorrow?
I'm sorry, can you repeat that, Senator Abler?
Well, I mean, tomorrow we're trying to move along with other things. So I was just going to suggest that people voluntarily waive their right to offer some random section that they just like in the bill that wasn't included without agreement. And so you still could do it, but just please don't. And tomorrow we'll put our effort into agreements. Representative Senator Hoffman, did you have something?
Mr. Chair, let me first of all remind you, I was never, ever in the lower body, so you can't call me a representative.
That's why you wear a tie so often, even to bed.
That is correct, and you know that. So a couple of things. Does that give us, are we okay on time? You know, my assumption is tomorrow.
We're good. Yeah, 1 o'clock tomorrow.
3 days, you're good?
I don't know, we're as good as we can be.
Right.
So we're going to try to get this wrapped up, and so,
Are we done with amendments?
I think so.
Mr. Chair, I have an amendment I'd like to offer.
Oh, well, go right ahead.
And I think this was sent out to folks, and I can send it to everyone if you don't have it, but this is the A73-1 amendment.
Madam Chair, this is posted.
It is posted. Okay, excellent.
It's being, Representative Liebling, it's being printed now, but you made your motion, so why don't you describe your amendment?
Okay, so, Mr. Chair, we talked earlier, way at the beginning of this conference committee process, about nurses in the hospitals of our state who have been really through hell during COVID and who are working short-staffed continuously all the time, and who are, as everybody knows, nurses are licensed professionals. They have professional duties under their license. And part of their professional duties is to make sure that they are practicing in a situation where they can give their best professional duty to their patients. And this is of extreme interest and importance to the people of this state, the patients who are in those hospitals. What the A73-1 amendment does is it prohibits employers from retaliating against a nurse when that nurse feels that they are unable to perform their duties because it violates their professional responsibility. So the core of the amendment says that the hospital or other licensed entity is prohibited from taking action against a nurse solely on the ground that the nurse fails to accept an assignment of one or more additional patients because the nurse determines that accepting an additional patient assignment in the nurse's judgment may create an unnecessary danger to a patient's life, health, or safety, or may otherwise constitute a ground for disciplinary action against the nurse. So this is, you know, I know there's been a lot of discussion. We had something that we carried through that passed off the House floor in our bill called the Keep Nurses at the Bedside Act, which was an attempt to address this problem of nurses being forced to work short-staffed, putting their patients' lives and health and safety in danger, and not being able to do anything about it. And so that is no longer being proposed. That's been, you know, we understand that's not going to be accepted, but this is really a very modest amendment because all it does is say that the employer cannot retaliate against the nurse when the nurse feels in their professional judgment that they cannot safely perform the task or take care of the additional patients who are being asked of them. And there's an exception in the amendment for emergency situations. Emergencies are very broadly defined so that, you know, of course, if there's an emergency, we all know there are situations, there's a weather emergency sometimes where new staff can't come in and people just have to do what they can do. And then they take whatever patients there are, and there are these crises that happen. But when it's not an emergency, there should not be retaliation against nurses for doing their jobs. And that is what this amendment does. And so, Mr. Chair, I am offering this, and I would very much like a roll call on this amendment.
Very well, Senator Benson. This is really loud. Senator Benson.
Thank you, Mr. Chair. I don't believe the Senate heard this. Which House committees was this heard in?
Representative Liebling.
Thank you. Well, Senator, I think I just explained that. This is replacing what we carried all the way through, and no, it hasn't been heard, as has not a lot of stuff. And you yourself just said to me a little while ago, well, you know, just because you didn't hear it. So I'm offering this in conference committee because I believe it's important. It's not long. It's way shorter than some of the other amendments we've been thinking about tonight. It's less than 2 pages. Folks have had it in their hands for a while. I think it went out, I don't know, yesterday maybe, I'm not sure, but I had it on my offer. We had some negotiation over it, so it's not brand new. So just like something you brought up as an amendment, you had rejected this earlier, I understand that, but I had rejected your amendment earlier too, and there it was. So I'm offering this, so I
Senator
think
Benson.
Mr.
it's
Chair.
important.
It sounds like this language wasn't heard in the House. Representative Liebling, what is the consequence for a hospital or another entity licensed under 144.5, 144.58 if they violate this? What's the consequence?
Representative Liebling.
Well, this fits into these sections that I don't think there's a specific consequence for it. I think it's the same consequences for other things that are required of hospitals. I mean, ultimately, they are licensed by the Department of Health. And so I think it's, there's no specific, it doesn't say that you're going to lose your license if you retaliate against a nurse, but, this is really it just says that our policy is that no one should be retaliated against for trying to do their job at the professional standard to which they are trained and held under their license.
Mr. Chair?
Senator Benson.
It doesn't say it's our policy. It says the facility is prohibited. If someone from the Department of Health can explain what the consequence is for these facilities. If we're going to do this language, and I'd like to hear from the Board of Nursing unless they're not available, but right now this looks like a no vote straight up, but somebody's got to explain to me. We might not be forcing these facilities to lose their license, but maybe there's a 3 strikes you're out sanction. We don't have any idea what this is. It wasn't heard in the House. It wasn't heard in the Senate. We haven't heard from the Board of Nursing. We haven't heard from the department. We absolutely need to vote no.
Is there someone for the Department of Health who can comment on this? Or if the Board of Nursing happens to be here, I can. Senator Benson, why do you wonder if they're watching? Do you know how many people are watching tonight?
Mr. Chair?
This is some of the best TV.
The hour is
We
late.
even had bumper music.
And this amendment probably wasn't
Fair enough.
noticed to the
They
Board
might
of
have-
Nursing.
Well, let's just see. So the Department of
Mr.
Health must have somebody here.
Mr. Chair, yes. Good
Commissioner
evening.
Malcolm, look at that. We've had 2 cameo appearances. This is something going to drive ratings. So welcome to the committee. This is a serious matter, but it's nice to
Yes,
see
it
you.
is. Yes, it is, Senator. I just wanted to say that we're here. And, I think Representative Liebling described it correctly. This would just be part of what we would expect hospitals to do and be part of the regular licensure and inspection process. I think Senator Benson, I would imagine we would have to potentially do rules to specify how exactly that would be enforced.
Senator Benson.
Mr. Chair, so we have no idea what the enforcement would look like. And at this late hour, it's a very bad idea. I would recommend no vote.
Other discussion? Is the Board of Nursing by chance watching? And if you do, you would just get huge kudos from us for civic engagement. So maybe that's too much to expect. All right. Any more discussion? Representative Liebling, final word? No?
No, I just would appreciate members' vote.
I think nurses shouldn't be retaliated against. So The clerk will take the roll.
Senator Abler,
Yes.
Senator Utke,
No.
Senator Benson,
No.
Senator Cran,
No.
Senator Hoffman,
Yes.
Representative Liebling,
Yes.
Representative Gomez,
Yes.
Representative Pinto,
Yes.
Representative Albright, Representative Schultz,
Yes.
There being 2 ayes and 3 nays on the Senate side and 4 ayes and 1 nay on the House side, the amendment is not adopted. Are there any more amendments that people want to offer tonight? Okay, Representative Liebling, do you want to talk about tomorrow, please?
So, Mr. Chair, we will meet at our scheduled time, which is 1 o'clock. I hope that we can meet. And in the meantime, I think we have some items that we need to be working on. This is only the public portion. And I hope that we can, we've discussed some things that maybe we should be adopting that are, more agreed upon items. And hopefully we'll get those lined up before we get to them so that we can adopt them expeditiously or discuss, kind of know what we're going to discuss if we're going to discuss anything. But quite frankly, I think, at this point, it would be much more productive for us to adopt the things that we can agree on unless we're really running out of time. In fact, I think we're pretty much out of time, honestly. So we're going to need to hope that we can start to resolve the fiscal issues because, we're waiting for, we gave you an offer that was, and then we got an offer back that really didn't make any movement, and we are quite stuck. So I hope that we're going to be able to break the logjam somehow, and if not, we're going to have to at least figure out whether we're going to send a separate policy or not, or what exactly is going to happen. But at any rate, we will be meeting at 1, and hopefully we can be productive and know what we're going to do before that time. And so our staffs, I think, will be in touch with each other and try to make sure that everybody is ready to go, and so we can use our time efficiently.
So very good. So you mentioned working some things out. Is there anything I'm supposed to be working on? I think Representative Schultz, are we done pretty much with our stuff? Except for these hashtags?
I think we discussed you making another off spreadsheet offer to the House.
No, I mean, in terms of the policy. Yeah, that's, way to stand, that's very good. You're right on message. That's good. But in terms of the policy, just seriously, I think you and I are pretty well
I think we're
complete.
almost finished.
Is there a couple
I
things
think
left?
we have a couple things left potentially.
All right, so if you can keep in touch with JP, and I'm just helping the audience and us to know what we have to do. Representative Liebling, are you done with your work with Senator Benson mostly, or are there,
Well,
there's still things? Okay.
I don't know. I think mostly we are. But I was thinking about this thing about the hashtags on the spreadsheet and so on. I mean, if we let the nonpartisan staff know ahead of time what we want to adopt, if we let them know that we want to adopt the things that have the hashtags that are already agreed to,
Yeah.
we could probably do that much more quickly tomorrow. So.
Sure, and I think they'll be prepared for that. So, and maybe the things that, at least there could be also I don't even know what all the hashtags are, to tell you the truth, but I mean, the ones that are unresolved, if there's some questions, maybe we should just resolve the hashtags the best we can tomorrow. And, and then if there's some things that we want to bargain for, then that could be something else. But, and just, I made a real effort, Representative Liebling, to not do anything fiscal in this meeting. I think we have had a very good day of accomplishment. And just simply to remind the House that we did give you an offer, and so we'll all both keep working on that. And thanks for your attention, everybody. This is, I think we're doing good. With that, we're adjourned. Good night.